Doctors out there, what is one important thing you'd recommend everyone for their health? Story 1, exercise. It's the biggest difference I see in my patients. 90-year-olds that feel and act 65 and 65-year-olds who act and feel 90. See in my office every day. The difference is exercise. You don't have to do anything crazy. Just do something and be consistent. I will also add that, in my opinion, the majority of arthritis is genetic programming, not age, weight, sports, etc. And the only thing that slows it down is, you guessed it, exercise. No cure for arthritis and nothing significant on the horizon for it. Orthosurgeon. Story 2, not an MD, but a PhD in psychology neuroscience. Get enough sleep and do so regularly. You're setting yourself up for serious cardiac and neurological problems later in life if you're constantly accumulating sleep debt now. If you're one of those people who thinks they don't need very much sleep or are too busy to get enough sleep, try getting at least 7 to 8 hours per night for 2 straight weeks. You'll see that you're more effective and work less distractible, less error-prone, and emotionally centered in general. If you have anxiety-related issues that keep you from sleeping, start exercising elevated heart rate, and preferably work up a bit of sweat at least 3 times per week. Story 3, oral health is often overlooked. So this is for anyone who uses a manual toothbrush if you can afford it. Buy a cheap electric toothbrush. Most people aren't great with their toothbrush technique, and an electric toothbrush makes it so much easier for most people to get plaque off. Just 2 minutes each time, twice a day. Point the bristles toward the gum line at a 45-degree angle and let the electric toothbrush do its magic. Story 4MD here. Be curious. Why you are the way you are, how you think the way you think, what you do the way you do it. None of us are given a manual for being, yet understanding our being provides so much more agency in life. If you can afford therapy, great. If not, self-help books, audiobooks, CBT apps, online courses and workshops, podcasts and YouTube channels, journaling, mindfulness meditation, and self-reflection exercises are all helpful. All the other things you'll likely read here. Exercise, stopping alcohol, cigarettes, eating healthy, better sleep hygiene, wearing sunscreen, oral hygiene. Their behavioral changes made easier when you understand your behaviors, cognitions themselves. Story 5, not a doctor, but a doctor told me exercise to where you sweat at least 20 minutes a day. That means if it takes 20 minutes to build a sweat dough, whatever you're doing for 40 minutes. This resonated with me, and I've been doing it for past 3 years, and I look younger in my 40s than I did in my 30s. It's like magic and Benjamin Button. Story 6, I'm a dentist. Don't drink pop or on Candace all day long. It's not a big deal to drink a Mountain Dew at lunch and a bag of Skittles after dinner or something. Just finish them quickly, and don't do it between meals. If you threw a Skittle in your mouth every 10 minutes the whole day, you're going to get a bunch of cavities. If you eat a bag of Skittles in 5 minutes right after dinner, it will have essentially no effect on how many cavities you get. Story 7, not an MD, a hospice nurse. When we reach our natural destination, the folks surrounding you are all you have left. The Harvard study shows community is very important for healthy longevity. Harvard study. Story 8, emergency physician. Get comfortable with talking about what we refer to as goals of care conversations with your family. In an instance where a family member can't advocate for themselves, what is important to them when it comes to their quality of life? I see so many situations every day where I have to ask families about if their elderly loved ones were to have a natural process occur and their heart were to stop, would they want to have CPR done, for instance, which is very violent, often involves breaking ribs, and requires me to put in breathing tubes and connect people to ventilators. It's much more brutal than TV. In the face of an emergency situation, when your loved one cannot advocate for themselves, I see so much understandable decision paralysis because people have to think about things they never have discussed before, and saying no seems like giving up or not advocating for your family. I had one case of a 102-year-old completely healthy who came in one day because her body clearly had decided it was done after a beautiful life filled with love and a large family. This family was shocked because she was fine yesterday and wanted everything done. I try to tell them that everything may not be worth risk of potential pain, suffering, etc. They were in complete shock and decided anything and everything I could do. This happens every day, and I never blame a family member. That's your mom, grandma, sister, cousin, best friend, etc. I get it. Ultimately, and thankfully, it is not my job to decide whether or not someone receives everything. It is the family. But dear God, if I were the 102-year-old, I would come back and slap the out of them. Talk to your family. Talk to your loved ones. Get your state-specific goals of care forms, and keep copies available. Let your loved ones dictate their care while they still can. Story 9, not a DR, but 10 years of dental assisting. Please floss your teeth. Between your teeth is the dirtiest part. Skipping is basically the equivalent of showering and not washing your butthole. Story 10, not a doctor, but a dietitian. If you need help managing your diet nutrition, needs anything to do with food, don't ask your doctor. Find a registered dietitian, not a nutritionist. Doctors usually don't know jack about any of it. And some of the shite my patients have told me their doctors have told them make me want to bash my head against a wall. Repeatedly, seriously, so much bad advice. Oh, and if doctors could stop telling people that all their issues would be solved if they just lost weight, and refusing to delve any deeper unless they do so. That would be great. The amount of patients I've watched slowly die because of this also makes me want to bash my head against a wall. Yes, we all know being obese isn't great for your health, but there's so many things that can prevent a person from losing weight. And you're leaving your patients in a really shitty spot by not continuing to investigate while patients try and lose said weight. Please help your patients. Don't just tell them they're fat and call it a day. Story 11. Besides the obvious smoking exercise, the amount of patients I see who do absolutely zero form of exercise is staggering. Even walking 10 minutes outside would help. Story 12. There's no one thing anyone can do for their health as good as quitting smoking, including cannabis, as you are still getting a big dose of carcinogens. If you don't smoke, then having a healthy diet would be the next biggest thing. Get regular exercise, eliminate alcohol consumption. If you're diabetic, keep very good control of it. Keep up with regular checkups, and don't hesitate to get something checked out if you're concerned. This is even more critical if you have a family history of cancer. Story 13. Use earplugs and preserve your hearing for as long as possible. Noise-induced hearing loss is the one preventable hearing loss. Untreated hearing loss is the one modifiable risk factor for cognitive decline and dementia. Mowing the lawn, earplugs, attending a concert, or even a loud bar with live music. Earplugs. Shooting a gun, yes, even just one shot. Earplugs. Earplugs come in pretty styles and designs these days. Spend a few extra dollars on the musician's earplugs to maintain good speech understanding. Earplugs are cool, protect your ears. Story 14. Everybody should deposit $100 in my bank account. The extra money is really weighing you down, and the faster you get rid of it, the better you'll feel. Trust me, I am a doctor. Story 15. Dermatologist here. Everybody recommends wearing sunscreen every day, but I honestly don't care about that. Wear sunscreen when you're going to get a lot of sun, when you're outside all day, go to the beach, going on a road trip, playing tennis, etc. Don't let yourself sunburn. Don't let perfect be the enemy of good. If you wear sunscreen during the days where you get the most sun, and you don't let yourself get burned, you should be able to minimize most of your risk of skin cancer. Sure, wearing sunscreen every day at all times is amazing, especially for reducing photoaging. But just wearing sunscreen during the big times and preventing sunburns is huge for reducing skin cancers. Story 16. Keep your Cohen Springs battery S magnets away from children. Don't buy motorcycles. It's just not worth it. Don't buy trampolines either. MD radiologist. Story 17. Avoid stress. So many conditions, diseases are flared up by it, and the long-term effects of constant elevated cortisol levels really takes a toll on the body. Meditation is a great way to do. Just sit in a comfortable position, close your eyes, take some deep breaths, and really pay attention to your body. Also, doing some light to moderate exercise is the cherry on top. Sincerely, a friendly family med doc. Story 18. I can't eat just one. Don't smoke or chew tobacco. Get your blood pressure and fasting glucose checked periodically. Hypertension and diabetes are both common and treatable conditions. Try to get regular dental care, brush and floss as recommended. Tooth loss and replacement can be painful and expensive. And most importantly, the U.S. has a healthcare delivery system that is wonderful if you are rich, but if you're not rich, the system will do everything it can to drain your wallet down to bare leather. We have embarrassingly high infant mortality rates and very mediocre survival into old age rates, both of which are markers of a failed or inadequate healthcare delivery system. I don't have a solution. Political opinions are flaming hot on this issue, but there is a problem that needs fixing. Retired internist and pathologist. Story 19. Yearly checkups with blood work along with regular diagnostics at various ages and risk profiles, including colonoscopy, EKG, chest x-ray, prostate check, mammogram, etc. There isn't much that can kill you that pops up out of nowhere. There are usually signs that things are going south years in advance, and these risks can be mitigated with early intervention. Story 20. Okay, not a doctor, but if something looks off, even if minor, don't wait. One that I ignored for months because I believed it was normal was my bent spine, the clear divot in my side. Story 21. Get enough sleep. Sleep deprivation literally takes years off your life. Too old people who sit down for too long won't be able to get back up again. Keep moving and active into your old age too. Obesity is a risk factor for like every disease. Even in medical school, when dissecting the heart, so many of the bodies had their arteries clogged up when we opened them. Story 22 MD here. Maintain a somewhat healthy weight. Don't smoke cigarettes or drink a lot of alcohol. My parents never did this, and it is always amazing to me how I will see patients who look older than my parents and then realize they are 15 years younger. Story 23, wear your seatbelts and helmets. They're ubiquitous for a reason, and you are not too cool for a life-altering injuries. Also, cannot emphasize enough how bad smoking is. Story 24, family medicine doctor here. Please see your primary care doctor. Early detection of hypertension, diabetes, kidney disease, high cholesterol, among others, are crucial. The damage these conditions can do to your body are very serious. I have many patients in heart failure, kidney failure, or with serious diabetic complications due to these conditions being uncontrolled. Story 25, obligatory. I am not a doctor, but this is important when you visit your Jeep doctor. They'll often ask if you smoke or how much you drink because they have to update their records. And that's true. They do have to record it. If you smoke, they'll tell you not to, and they'll then note on your file that they've told you that. It's often a target they have, but they'll do the same with alcohol consumption. If you answer honestly and say, I have 2 bottles of wine on a Friday, maybe 7 beers on a Saturday, and probably a few drinks through the week, then they'll tell you to cut down. But now that is on your record, it's on your record that a medical professional has advised you to reduce your alcohol consumption. So why is this important? When you apply for life insurance, one of the questions will be, has a medical professional ever advised you to reduce your alcohol consumption? You might not actually have a drinking problem the slightest, but if you answer yes, then it will probably increase the cost of your policy. If you answer no, you've potentially invalidated your policy because when you die, they'll see it was on your record but was not declared. If you do have a drinking problem, always tell your doctor because they will help you. If you just drink casually but a bit above the very strict recommended amount, maybe be a bit careful about what you tell them because then it's on your record. Story 26, not a DR, but told to me by a DR, do not fly without wearing compression socks. Deep vein thrombosis DVT is no joke. If you throw a saddle embolism clot, you'll be dead in minutes. In fact, if you're going to be sitting anywhere for 3 hours with limited ability to get up, move around, wear compression socks. Story 27, family doctor here. Find a type of exercise physical activity you enjoy and do it regularly. Ideally, this would be a mix of some form of cardio, as well as strength training, weight-bearing exercise. Incorporate more veggies into your diet. Try to divide your meal into 50 veggies, 25 lean protein of some kind, and the last 25 could be a carb, e.g. whole grain. Snack treats are usually fine, but everything in moderation. Drink enough water fluids each day. If your urine is a pale yellow, you're probably good. Avoid smoking and limit your alcohol intake. Technically, should be no more than 2 alcoholic drinks a day for men and no more than 1 alcoholic drink day for women. Sunscreen, some form of sun protection daily. Even in the wintertime, UV can still reach you through clouds, even if it's not as much. Good for prevention of skin cancer and also if you care about how your skin looks. Story 28, exercise regularly. Figure out what you need to do to get it done and sleep enough. Eat real food, including protein, vegetables, and fruit. Consider getting alcohol out of your life. Story 29, pause. Find spaces of near zero input to let the nervous system calm down. The cumulative effect pays dividends on so many health conditions, including hypertension, cardiovascular disease, sleep quality, mental health, etc. Story 30, actual MD. Vitamin D. I know it's debated, but it's harmless at a reasonable IU. Exercise, regular checkups, eat healthy. If anything seems out of the ordinary, heart, lungs, fitness, pain, stool, odd sensations, find a way to see a doctor. Story 31-1. Move your body, stand more, walk daily, exercise moderately but constantly 2. Stay away from processed foods, sugar, artificial sweeteners 3. Sleep well 4. Use sunscreen 5. Manage your stress better 6. Stay hydrated with water 7. Do not smoke or do drugs 8. Limit alcohol consumption 9. Keep your brain engaged, learn a new language, a new skill, a new instrument, etc. 10. Stretch. Even 10 minutes a day can do wonders for your health. Story 32. I have had chronic back pain for years. My back was constantly going out. I decided to get serious. I went to PT for 2 months now. I do 25 minutes of back exercise daily at home. I've been pain-free for 10 months. Unbelievable. Story 33. I'm not a doctor, and I don't play one on TV. However, there are 5 most important things you could do to increase longevity and improve your health. 1. Don't smoke. 2. Exercise. 3. Eat right 4, manage stress 5, get enough sleep. I remember reading somewhere that the lack of exercise has just about the same effect as smoking. Story 34, I'm an ER physician. I'm not going to say anything different than some of my other fellow docs, but just want to reiterate, exercise, at about age 40, you really start to see the difference in people who actually take care of their bodies versus those who don't. The people who take care of their bodies look younger, feel better, and have less health ailments. And when those people who do care of their bodies get sick or have some medical problem, happens to everyone, their likelihood of recovering and their speed of recovery is directly dependent on how they take care of their bodies. Another one is to not smoke cigarettes. Any person over the age of 50, I can tell if they're a smoker or not. And dying of COPD is a long, painful, horrible, suffocating experience I would not recommend to anyone. Story 35, not a doctor. But don't forget about annual checkups with your primary doctor and specialists if needed. You might not even recognize that you're having symptoms of something until a doctor points it out. You don't need to be in dire need of glasses to see an eye doctor. Eye health is very important, and eye abnormalities can signal that something else is wrong in the body, like diabetes. If you have dry eyes, for example, you need to be seen yearly, even if your vision is fine and your symptoms are well controlled with eye drops. Story 36, stay on top of getting your colonoscopies, mammograms, pap smears, and all other screening tests. Cancer is a lot easier to treat when it's caught early. Story 37, death is part of life. So many people are afraid of death for loved ones and commit them to trach PG and attach when the patient can't make decisions anymore. That is honestly worse than hospice. Take hospice referrals and goals of care conversations seriously when we do them in the ICU. We're not doing them because we want people to die. We're doing them because their life expectancy is very poor. Story 38, diet and exercise, of course, and listening to our recommendations on other things such as vaccines. The one that occasionally surprises people, though, is regarding the importance of sleep, which is gaining more attention recently, perhaps. Story 39, not a doctor, however. I work closely with several dermatologists. I know that they always emphasize the importance of wearing sunscreen. Utilizing it slows down the aging process of the skin and helps prevent skin cancers. Story 40, OP, stated doctors out there in the question. Out of 958 comments, I think 3 were from actual doctors, which by the way means nothing. I see opinions as usual from people who have no medical background whatsoever. I do agree with the walking and moving, and I am no doctor. Story 41-1, eat better 2, move more 3, sleep 7 to 9 hours a day, every day 4. Oral health is important 5, 2 to 3 times a week, stretching and meditation 6. Don't be alone. Surround yourself with positive, supportive people 7. Avoid processed food, refined flours and sugars, soda, alcohol, cigarettes, and drugs 8. Be introspective, don't be on autopilot, and keep a spotless home. Not a doctor, but many doctors have tried TO, fix me. Story 42, healthcare professional who recently got diagnosed with cardiac condition, been active, followed health diet, wore sunscreen, slept adequately. 1, always check in with your healthcare provider before strenuous activities. 2, always ask questions to your healthcare provider. Story 43, stop eating fast food. It isn't real food and can alter your microbiome permanently if you eat that type of food for too long. It's why 40-year-olds are now getting colon cancer at an alarming rate. Story 44, nurse, but close enough. If you lose a bunch of weight in a short period of time without trying to get you to the doctor, I've had to cry over terrible cancer tissue samples from young men like he's 37 with young kids on stage 4. That one got optimistic 6 months. We sent flowers and Doc called his wife and gave some grief options. He knows all the people. Story 45, don't smoke. Cancer, stroke, heart disease, arterial disease, lung disease are all caused by smoking. If you don't smoke, don't ever start. If you do smoke, quit today. Story 46, the best old people, strongest, healthiest, are the ones with tone, muscles, and purpose. Think farmers took 3 people and a ton of prop to get this one dude's artificial hip back before he scurried away. He was 93 as a student, remember, shadowing a geriatric doc who had a 90-years-old chick who dressed in pink Valor outfits and did yoga daily. She refused to use protection during BC. Why bother? 90 while they're 50 years old in nursing homes who are so deconditioned as to be disabled and have nothing propelling them to the next day. Story 47, young doctor with latest in training in tech versus old doctor with decades more experience. I think back then it may have been a debate, but now new tech might be more preferable. Any opinions? Story 48, my father's a very healthy 83-years-old retired surgeon, and he said he had 2 pieces of advice from doctors early in his life that were life-changing. Take vitamin D and avoid carbs. Story 49, sleep. Exercise, fruits, and vegetables are the general things, but what I think gets overlooked is excessive phone computer screen time. Try to minimize that as much as you can, especially in the morning. Your brain wasn't designed to absorb so much info from scrolling in the morning, and you end up not being able to focus at work or school. Story 50. Eat healthy food at regular intervals. Stop overeating. Control your appetite. Take less sugar. 30-minute walk every morning. North Dakota. Evening, early dinner, less stress. Have good life. Story 51. Have a schedule. Go to bed and wake up at the same times or close as possible each night. Eat a balanced diet. Low carb if possible. Less is more with food. And try to exercise 45 minutes a day. Even if it is walking a few miles, those 3 things will generally fix most issues. Story 52. Stop drinking alcohol. Any kind. Stop smoking any kind of smoke. Stop doing drugs, marijuana, or whatever. Stop eating so many carbs and fats. Cook your own food. Don't eat garbage fast food all the time. Do moderate exercise regularly. Just go for a walk or bike. Ride. Don't spend all your free time glued to a screen, phone, or TV. Read books regularly. Your brain will thank you when you're 70. Talk to your family and friends. Don't be antisocial. Sorry for the long post. Hey, race a healthy. Story 53. Minimize your cardiovascular risk factors. Don't smoke. Eat well. Keep weight under control. Exercise on a regular basis. Another important aspect is be aware of your blood pressure, cholesterol, sugar levels, and keep them under control. Story 54. Go out in the sun and get some vitamin D. I have been a GP for 20 years, and I see at least one patient a week with dangerously low vitamin D levels. Story 55. Not a doctor. Just like to preach this. Get your butt checked. Colon cancer is showing up in younger people, especially men. It's not bad at all. Just get your butt checked. Story 56. Family doc here is said that if the benefits of physical activity could be embedded in a pill, it would be the most prescribed medication in all of human history. The last 150 years, we have been the most sedentary our bodies are designed for. Pretty much constant movement, which is why it doesn't require intense exercise to be healthy. Just keep moving. Story 57. Cut down on caffeine. Seriously, there's a sleep deprivation dysfunction epidemic, and the burden on physical and mental health is massive. Caffeine has a 6-hour half-life. Yes, you may be sleeping, but normal sleep cycle is still disturbed. Of course, exercise, diet, blah, blah, blah. But for low-hanging fruit benefit to effort ratio, cutting down on caffeine is probably the easiest thing that would have beneficial impact. Source: I'm a pulmonologist, which is a specialty most sleep doctors come from. Story 58. In healthcare as an RN. So many chronic illnesses we encounter are wholly preventable. Also, most issues are further complicated if the patient is already in poor physical shape. Exercise and eating a balanced diet will stave off so many chronic issues as you age. One thing that stuck with me was once I had a patient, JD, who was barely 50. JD suffered from hypertension and some diabetes, was also getting treated for ulcers for legs. JD was sedentary and overweight. Among his many, many issues, JD live a life of just doing whatever. Compare this to my 55 years old Brazilian black belt in my BJJ gym. Of course, he's nowhere near how he was in his prime, but good God, he rips us apart when he decides to spar with us somewhat seriously. From a young age, he basically lived his life like an athlete, and he's reaping the benefits as he aged. Story 59. Not a doctor, but I recently saw a large compilation of many meta-studies which concluded that the 2 biggest common factors for people living a long and happy life was staying physically active and having the desired amount of valuable social relationships, especially one with a partner. I've also read separately that you can keep life enjoyable for longer if you make sure to stay mentally fit by doing things which keeps you mentally active: crosswords, Sudoku, Rubik's Cube, complex knitting, quizzes, you name it, use your brain. Story 60. ICURN here. It doesn't matter what age you are. Make sure your loved ones know your last wishes and what you want done if you can't tell people yourself. I can't tell you how many times I've had patient come in where the family has no idea what they'd want done, and so they pull out all the stops to prolong life. If that isn't something you want, it could be torture, not just for the patient, but family not knowing if they did the right thing. There's a book called I'm Dead. Now What? It's a journal that to fill in the blank with everything from your social media log and passwords, important financial information, to in-depth stuff like if you're a veteran, who to call if you want military honors or to be buried at Arlington, and other stuff like that. Having everything laid in no uncertain terms can ensure that your wishes are respected. I cannot recommend it more, because the greatest gift I can give a patient, if it is their time, is a death with dignity. The greatest gift I can give a family member is telling them you're doing the right thing. This is what they wanted. It can save so much heartbreak. Story 61. Live in the present. Use the present to repair issues of the past that cause sadness. And prepare for the future in the present if you must. Just realize that spending too much time in the past or the future can be quite detrimental to our mental health, also causing physiological disease. Story 62, not a doctor, but a radio tech, and I swear, don't let your weight fat get too consequent if you want to save your articulations for as long as possible. Story 63, get rid of your car if you live in a city. You will move more naturally, leading to better physical and mental health before you know it, also smaller risk of getting hurt in a traffic accident. Story 64S1 through 100, don't smoke cigarettes. 101, don't be overweight or worse yet, obese. 102, don't drink and drive. 103 is for young men. Don't do any kind of crazy stunt in order to impress GF or buddies. 104, wash your hands thoroughly and regularly. 105, brush and floss. Story 65, I have to share this, so my doctor friend can remain anonymous. Maybe it is not you. Maybe you don't need that antidepressants. Maybe you don't need that anxiety pill. Maybe you just need to admit that sometimes staying is actually harder than leaving. You stayed so long trying to make it work at home or at that job, you might have forgot that it shouldn't be this hard. Leave the person you know on some level is not your person. Leave the job that has you so stressed you're in the doctor's office. Stop with trying to make it work with drinks to cut the tension and pills to dull what your brain needs to hear. It's time to change your situation because the unknown is scary, but sometimes what you know is even worse. Story 66, how can I still exercise when I have severe fibromyalgia? I have had it since my late 40s and now at 65 am noticing signs of loss of muscle mass. I get flares after I attempt any form of exercise, and it's beyond frustrating. Story 67, know what meds you're on and why you're taking them. Also, if you have high BP, keep track of it at home. Chances are your hypertension is only white coat. Story 68, so I'm seeing a lot of people saying to exercise and move around. Any type of advice someone could give me would be appreciated. I have AMPS and am disabled. It's very difficult to move without intense pain. It's cold is where I live, and I do virtual schooling for most of the day. I also get very little sleep because of pain. Any suggestions from anyone on how to get moving with all these struggles? Story 69, hard to do for some, but stop smoking, and especially stop drinking alcohol. Leads to an early grave. A temporary buzz is not worth losing years off your life. If you must drink, get into juicing after weaning off coffee. Tea is fine. And if you miss smoke, for the love of God, smoke cannabis. It's not for everybody, but we've seen an over 90% decrease in seizures with epilepsy in children and adults. Cannabis also alleviates Parkinson's symptoms in many. I don't smoke anymore, really anything, but if I did, you bet your bottom dollar would be God's good green stuff. Alcohol is poison. Eat less, exercise more. Okay, ran over LOL.